Oops. Oh, okay. Let's try this. Hello, everyone. For this case study, we're asked to respond to the comment. They sure are trying to make it seem as though everyone has depression these days, even pregnant women. After reading the brochure, I think this statement contains both some truth and some incorrect assumptions. To analyze it, I'm going to use information from the textbook and the lecture notes rather than just sharing my personal opinion. First of all, one thing the person is correct about is not everyone has depression and not every pregnant woman experiences depression. The brochure states that approximately 1 in 7 women are treated for depression sometime between the year before pregnancy and the year after giving birth. That means the majority of women do not experience clinical depression during that time period. So we are going to go to our textbook and hopefully you can see this. It says depression is a significant medical condition in which feelings of sadness, worthlessness, guilt, and fatigue interfere with one's daily functioning. Depression can occur before, during, or after pregnancy. And as I said, 1 in 7 women are treated for depression sometime between the year before and the year after, according to the March of Dimes. So yeah, 13% of pregnant women take antidepressants during pregnancy. It's important that women taking antidepressants during pregnancy discuss that medication with their healthcare provider. According to the textbook, which I just showed, depression is a significant medical condition in which feelings of sadness, worthlessness, guilt, and fatigue interfere with daily functioning. This definition is important because it shows that depression is more than simply feeling sad, stressed, or overwhelmed. It's a medical condition that affects a person's ability to function in everyday life. However, I think the speaker is incorrect when they imply that depression during pregnancy is not a real concern or that healthcare providers are exaggerating the issue. The brochure clearly explains that depression can occur before, during, or after pregnancy, and it identifies specific risks associated with untreated depression. The lecture notes explain that depression during pregnancy can affect both the mother and the baby. According to the materials, babies born to mothers experiencing depression may be at a greater risk for premature birth and low birth rate. Wait. The notes also mention that the babies may be more irritable, less active, and less attentive to and display fewer facial expressions. And I am going to go to the lecture notes, which are right here. It can, and as you can see from your lecture notes, due to the added demands of caregiving, increased financial strain, and decreased time spent as a couple, gender roles often become more traditional. There's also a decline in marital satisfaction through the husband's level of affection and awareness to his wife's daily needs, as well as shared caregiving. If the mom expects or experiences an unsupportive partner, it's predictive of a decline in marital satisfaction. It also says that couples who postpone parenthood until their late 20s or their 30s often experience easier transitions into parenthood because they have more job and life experience, and at these ages, they're more likely to be excited about fatherhood, the dads. Okay. The lecture notes explain that depression during pregnancy can affect both mother and the baby. According to the materials, babies born to mothers experiencing depression may be at greater risk for premature birth and low birth weight. The notes also mention that these babies may be more irritable, less active, less attentive, and display fewer facial expressions. Because these outcomes can affect infant development and maternal well-being, it makes sense that the healthcare providers would want to educate patients and screen for depression. The person making the comment is also making several assumptions. One assumption is that because depression is talked about more frequently today, it must be overdiagnosed or exaggerated. Another assumption is that pregnancy is supposed to be a happy time, so women should not experience depression while pregnant. A third assumption is that discussing depression means labeling everyone as depressed. The brochure does not actually make any of those claims. It does not say all pregnant women have depression. Instead, it provides information about who may be at risk and why recognizing symptoms is important. I think a better response from the person would have been something like, I didn't realize depression could occur during pregnancy. Why is it important for doctors to talk about it? That response would encourage learning and discussion instead of dismissing the information. To make this discussion richer, I think it's important to consider why depression during pregnancy may seem sometimes go unnoticed. Many people expect pregnancy to be a joyful experience, which can make it difficult for women to admit when they're struggling emotionally. Some women may even feel guilty about experiencing depression during a time when others expect them to be happy. Another point worth discussing is that women who have experienced depression in the past are more likely to experience depression during pregnancy. This means healthcare providers need to pay attention to a woman's mental health history, not just her physical health. I would also connect this discussion to the broader idea that health includes both physical, mental well-being. We often focus on prenatal vitamins, doctor's visits, nutrition, and exercise during pregnancy, but mental health is also an important part of a healthy pregnancy. If depression is identified early and treated appropriately, it may improve outcomes for both the mother and the baby. In conclusion, the person is correct that not every pregnant woman experiences depression. However, they are incorrect to suggest that depression during pregnancy is not a legitimate medical concern. Both the textbook and the lecture notes describe depression as a serious condition that can affect mothers and infants. Rather than dismissing the brochure, a more productive approach would be to ask questions and learn why healthcare providers consider maternal mental health an important part of prenatal care. Thank you. Again, my name is Jill Edwards, and this was my Chapter 2 case study on postpartum depression. Please, for the love of God.